Hi everyone, I'm Ziad Ahmed, and I'm in New York City for the third annual Americares Partner Summit. I'm excited to welcome our next guest to continue the conversation happening here at the summit, Dr. Rashad Massoud. Welcome, Dr. Massoud.
Thank you, Ziad.
Well, I'm excited to chat. And you oversee global programs here at Americares. And so I was wondering if you could tell us a little bit more about the organization's work to improve access to healthcare for people around the world.
Certainly. It's a great question, and it's something I'm very excited about. The most important thing is that it is global. We're trying to help people in poverty or disaster all over the globe.
Wow, it's incredible. You've also led Americares' response to the COVID-19 pandemic. So how did the organization respond to the needs of health workers and communities around the world, given your global breadth of the work that you do?
That was not easy,
Yeah.
and it was at a very difficult time, but it was an all Americares consolidated response. And I'm happy to say that we not only provided technical guidance, but we also were able to provide the prophylactic supplies for COVID. We also provided mental health support in these difficult times. So it's been a long journey, and it continues. Sure. It hasn't ended yet.
No, of course not. Of course not. It's important work. And Americares has a long history of supporting the health of refugees and internally displaced people specifically. What is Americares currently doing to support refugees? Where is this work taking place around the world?
So, of course, we're all aware of the crisis in Ukraine, and that's a big effort underway right now. But that doesn't make it the only one.
Yeah, not.
We're still working with Venezuelan refugees in Colombia, where it's a major effort, and I was just recently there.
Wow.
It's very impressive to see how deeply connected to the communities our team is, and how supportive of the communities and how engaged they are with us. We also continue to work with Syria, with Yemen, with Bangladesh, with multiple places.
Alhamdulillah.
Alhamdulillah.
I love that. Health equity is a key part of Americares programming. How are you addressing health disparities in your work?
This is a great question. So there's the general way in which we address this, and that is basically we're targeting those most in need, the people in disaster or in poverty. But also there's a very sort of like, I talk about blunt tools and I talk about sharp tools in the work. And I say there's a sharp tool, which is whatever we do, we're trying to stratify by different causes of inequity. So look at the outcome, look at the differences for different groups. For example, this work has now really taken hold in India, where we're working with hypertensive patients, and we stratified by different causes of potential inequities. We found that there's actually a gender inequity.
Yeah.
And the gender inequity is basically related to the fact that males are, for the most part, unable to come to the clinics at the time of the clinics because they're out at work.
Interesting.
So we redesigned the way in which we're providing care, opening up opportunities for males. And I have to say, not only did we improve care from like 60 to 79%, that's blood pressure control in hypertensive patients, but we cut down the gender inequity gap by half.
Wow.
Which was really significant. And this is continuing work. And
Wow.
Our plan is to use this sharp tool throughout our programs and make sure that any potential causes of inequity are uncovered and are addressed.
That's so important. Well, thank you so much for teaching us and for taking the time to speak with me today, Dr. Massoud.
Ziad, thank you very much. It's a pleasure to work with you, and it's a pleasure to see all the wonderful things that you're doing as well.
Thank you. It's my pleasure and privilege.